Thanks so much, Mr. Taylor. That's the Tallahassee Urban League, and I agree. We should stay consistent on these meetings. I told Tori I did not need a mic, but we'll see what I can do with holding this up while I'm talking real loud. Hello, everybody. My name is John Brown. I'm the founder and chief advocate for Black Men's Health. And we are focused on creating more balance through health for men of color, specifically Black men. We focus on holistic health. And when I say holistic, I don't mean medicinal or herbal or anything of that nature. I mean the whole man. So mental, physical, spiritual, financial, social, the whole man. As I've had a chance to talk to Leroy and Alondre about it, the whole man, which is important. So today we're talking about stroke. I want to thank you all for being here and joining us tonight, and for all the people out in the world on Zoom. Thank you for time into this conversation. And again, we're here to talk about stroke. May is Stroke Awareness Month. And our goal here is to educate everyone on the signs, symptoms, and risk factors for stroke to hopefully combat these medical emergencies. So awareness is key, education is key. That ties into confidence, and we're going to find out a little bit about the hero. One of the heroes today. There's a lot of heroes in TMH. Some of these nurses and nurse teams and leaders are heroes also, but we got a hero here today I want to talk about, and that is about awareness, education, action that I believe comes through confidence. So today we're joined by an incredible panel, including Dr. Marianne Ferris, an interventional neurologist, I hope I said that right, with Tallahassee Neurologic Clinic in TMH, and Dr. Jerry Maxwell, a family medicine resident at TMH. And of course, we're honored to have the man of the hour, Mr. Leroy Smith, who recently survived a stroke. Very recently, I was honored to be able to sit in his home and have a discussion. Thankful, as Mr. Taylor said, thankful to God for him to be here, thankful for me to be here, thankful his son to be present, and also his son, the star, the hero, Alondre, who's also here with us. And we're going to hear more from both of them. For those of you who are joining virtually, if you have any questions, please go ahead and submit them in the question and answer, the Q&A feature in the Zoom, and we'll be monitoring that throughout the discussion, and we'll make sure that we get to you. All right, so let's get started. We're going to go ahead and start with Leroy. And Leroy, why don't we just start by you introducing yourself, telling us a little bit about yourself. Tori and I had a discussion. We could have sat there and talked for hours and hours and hours, but they're not going to let us do that tonight. These folks got to get to dinner and kids and celebrations for fifth grade and things of that nature. But Leroy, start off and tell us a little bit about yourself.
My name is Leroy.
Mike, also, Josh.
I'm sorry, there's a microphone right there.
Hello,
Okay.
my name is Leroy Smith. I'm from Quincy, Florida. I went to Florida State, played ball for Bobby Bowden and the NFL. I'm a business owner, and I just had a stroke on April 26th.
And you talked to me for hours. Sure.
Yeah.
Tell us a little bit more about your ball playing days. You're gonna make me drum it up and talk about shanks and
That was pretty good. Shanks, I'm gonna look at you.
don't be humble in here. Don't be humble in here.
I was pretty good. At Shanks, basically, Coach Bobby Bowden came to my school and basically offered me a scholarship. Then I, went there, played pretty good. Got a chance to get notoriety throughout the community, and basically, fulfill my dream to go to the NFL. And then I came back, talk for a little bit, and then I started, running my businesses, to basically help the kids, through education. But it was I basically, let me know a minute. So I basically drag them, not drag them, but entice them through sports. And so that's the story.
I think you used the perfect word, drag. Me and Auntie LaShawn were just talking. We gotta drag these kids.
Yeah.
So you're doing amazing work in the community. I know that.
Absolutely.
Having these connections and these relationships is so important. I have had several conversations when I got asked to moderate this and finding out more about Leroy and all the wonderful work he's doing. So Leroy and Alondre and I have already discussed, we're gonna be talking way further after this evening's discussion. So it's good to be intentional about having these discussions so we can connect, especially for the impact for our community. So Leroy, if you would, tell us about your experience, if you would, with stroke and what happened that day.
Me and Dre, me and my son, we was going to work out. I went to the car. I got a headache. My son got in the car, and then he asked me, Dad, what was wrong? And then he witnessed me drifting to my left, and then he called 911. That was it.
Did it cross your mind? This is something we asked about, when we talked to you recently. Did it cross your mind at the time that you were having a stroke?
Oh no, I didn't know. I didn't think I was having a stroke. I just thought I was just having a regular headache. So I just, I didn't know. It didn't cross my mind.
And you told me you were still attempting to exit the vehicle.
I was
about the business.
I was trying to, crank up the car, and then my son, he was smart enough to get out the car, and he basically called 911.
Hey, Alondre, from your perspective, tell us about what happened that day. What did you see from your perspective?
He got most of it right for the most part. We was headed to the gym. I came down. Once I came down to sit in the car. Once he got into the car, he said his head was hurting for a minute. Then I seen all the symptoms like face drooping, arm weakness. Like he was trying to start up the car, but I can tell that his arm was a bit weak. And it was drifting down. And I asked him, I called his name a few times, and he wasn't. It took a minute to respond. But then that's when I noticed, okay, he need medical care, like in the hospital. I got in the car because I didn't want him to try to crank up the car, go about the regular day. Called 911. He tried to get out the car like he said. And I was like, no, just take it easy, Chris. Wait for the EMS to arrive.
How are you aware of those symptoms, Alondre? What information, education have you learned in the world or seen in the world that even allowed you to recognize what was going on?
I want to say I've seen a few commercials about strokes. They came on like just randomly commercials. I attended a few clinics like a few years ago in college and high school about strokes. That was just a real world experience, to prepare me.
Thankful for the timing and your presence, yes?
Oh yes. We could have been like I said, he drove to the home normally fine. The stroke could have happened then, or someone was leaving on the gym.
Or without you.
Exactly.
Yeah. And what made you decide to call 911 immediately?
Just the signs and symptoms, like especially like I know my dad. I'm present with him most of the time. I know he wasn't acting like himself. That I just knew he needed medical care.
We talked a little bit that day about, just something being off, right?
Yeah.
Which is something we gotta pay attention to, right?
Yeah.
Taylor said that earlier, right? Especially as men, sometimes we just push through.
Yeah, I could tell he was like a bit confused and stuff, but yeah, I knew he was all the way out of care.
I mean, Leroy, if you could have pushed through, I mean, you tried to get out of the car, and
Yeah,
if you could have pushed through, you probably would have.
yeah.
You gotta definitely, as men, right, and those who love and care about men, you gotta learn to, as Mr. Taylor said, listen to ourselves, listen to our bodies, and pay attention to these signs that are, telling us. That's a whole nother discussion. We can have a whole nother conversation about that. So obviously, Alondre, you made the right decision, but all of us are thankful for that, right? You're here today having this discussion with your dad, and, ultimately saving his life, right? I know, Tori don't want me to say this now, but I love this, right? Time is brain. And that's something that I'm sure the physicians will tell us more about, and time in general, right? I mean, us being proactive as men, us being proactive as people, time is so critical with our health, right? So now that we heard about, Leroy's experiences, I want to know learn something about the basics of stroke. So for Dr. Ferris, tell us exactly, what's a stroke? What's going on in our body?
So in Leroy's example, Leroy, you had an example of an ischemic stroke. And what that is essentially a clot coming from somewhere going, thank you very much,
Yes, ma'am.
going into one of the vessels into the brain. And when a clot occludes the vessel in the brain, it can stop that flow of blood to that part of the brain that can give us a function. And in your case, it was what you call the left MCA, or the middle cerebral artery on the left side. So you were probably having some weakness on the right side, as your son had noted. And unfortunately, when that happens, it means that brain cells die, and every minute counts. And that's why we have the motto, time is brain, and that is very, very important. And so I commend your son very much for knowing what to do when he noticed that, because time is brain. So there are examples of other strokes, but with regards to you, you did have a clot that went to a vessel in the brain that stopped blood flow into the important part of the brain. Now, there are other strokes, and that can be bleeding strokes, or what we call hemorrhagic strokes, and that could be a bleed, but we can go into that a little bit later.
So how does a person recognize if they are or someone else is having a stroke?
So an acronym that we like to use is Be Fast. So if we remember that, Be Fast, and honestly, it may be one of the things your son saw in the commercial. So if we think of Be Fast, B meaning balance, and I think the cards that we've given out can illustrate that very well. So think of any balance issues, that could be an indication of a stroke, certainly in the back of the brain. And when you think of E, B, so E can be eyes. So let's think about the eyes, whether you have binocular vision loss. So one of your eyes has lost vision, either lasting a long time or even momentarily. If you're having any blurry vision, double vision, or feeling like one side of your world is gone, that can also be indicative of issues that can come from stroke. Face, F, face. Again, droopiness, numbness. A, arm, whether or not you're having numbness of your arm, whether you're having drooping, you're dropping your cup, you can't hold your pen. S, speech, whether or not you can get words out, whether or not you're having issues with garbled speech, not making sense, having problems with articulation, being slurred. And then T, which is very important, and that is time. That's time to call 911 or come to the hospital as soon as possible, because like we mentioned earlier, time is brain, and any minute that goes past, more and more brain dies, and the potential for you to have permanent symptoms from your stroke is more likely.
So again, Dr. Ferris, I think education and awareness clearly are critical in these moments, right? Not only for individuals realizing what might be happening to a loved one or a friend, but also us as individuals realizing and recognizing what's going on in our own body in that situation. Now, again, we're very, as I've said multiple times, and I will continue to say it, very thankful to have Alondre there and be present with Leroy. But if one were by themselves, what should they do immediately?
So one of the issues with stroke, actually, it's unlike a heart attack where you feel pain in your chest and you know that you could be having a heart attack, you come straight to the hospital or you call 911. Stroke is painless for the most part. Sometimes stroke can come with a headache, like in your case, Leroy did come with a headache, but oftentimes it can be silent, so you may not recognize it in yourself. But should you feel that you're having some weakness in your arm, should you feel like numbness is occurring, should you feel like you're not able to get your words out, or you're having difficulty with vision, this certainly is a possible stroke. So you should come to the hospital at that point and call 911 immediately. I would say better to be safe than sorry.
Right.
And should you have any question or concern about anything like that, definitely be on the safe side and call 911.
So for all my brothers out there, not gonna be macho and try to suck it up and push through, have somebody drive you to the hospital immediately. Yes, time is brain. Okay. Thank you, Dr. Ferris, for letting us know more about that. Dr. Maxwell, what puts, and this is a question I wanted to know, right? What puts a person at risk for having a stroke?
Yeah, so what puts someone at risk is that there are risk factors that you can control. There's also risk factors that you may not control or not be able to control. The ones that you can control are you want to monitor your blood pressure because high blood pressure is a risk factor. Your high cholesterol levels, having diabetes, and also, if you're not very active, can put you at risk of having a stroke as well. Or someone who may have heart disease, watching out for the irregular rhythms of your heart. I don't know if you've heard of atrial fibrillation, or AFib for short. It's where the heart has an irregular beat, and that can put you at risk of having a stroke as well. And some other risk factor is those that might have sleep apnea. It's where they don't get enough oxygen to the brain while they're sleeping. So you might hear that someone is using a CPAP machine for sleep apnea. And so having sleep apnea can put you at risk of having a stroke as well. Some of the risk factors that you don't necessarily have control of is if anybody in your family has had a stroke. That puts you at the higher risk of having a stroke. So if you have anybody with a family history of it, and those unfortunately of African American descent can be at a higher risk compared to those that are white as well, can be at a higher risk for having a stroke as well. So those are just some risk factors to take into mind.
Thank you, Dr. Maxwell. And we speak about, obviously obesity and diabetes and high blood pressure and things of that nature. A lot of stuff you can monitor yourself. Some of the things you can, a doctor can help you monitor. I have often said, the work we do at Black Men's Health, like thousands of lives could be saved by the complexity and the simplicity of us making appointments and keeping them. Right? And we have to encourage brothers, men in general, right? Specifically Black men in my work, we gotta really push and encourage brothers to be making these appointments and keeping these appointments. We all are very busy, super busy, and have hundreds of reasons to not go to the doctor or miss our appointments, but we need to reschedule, and while we're there, not leave out without rescheduling or creating another appointment, because it can help keep us on track and help look at those metrics and understand where we are and deal with the reality of that. So Leroy, do you have any of those risk factors that Dr. Maxwell spoke about that could have put you at risk?
Sleep apnea. Sleep apnea. I have sleep apnea, but I think that was probably the cause of it.
Something else you said to me when I was asking and just learning more about it, I was like, what might be something else that potentially could have, created a situation? What do you say?
Stress,
Stress.
combined with sleep apnea.
Y'all know anything about stress? The weight that we're carrying on our shoulders at times, unfortunately, we gotta work through that. And another thing you said, Leroy, is, hey, ball player, great condition, working out, right? You own it, you act.
Yeah.
Right? And the folks in the community know you, right? They know you, that's what you do, right? So, as an individual and internalizing that, sometimes you could be like, not me, but obviously that's not the case.
Right.
We gotta stay on it for each other. So Dr. Ferris, are you seeing strokes in again, Leroy's 41, right? Are you seeing strokes in younger populations with different risk factors?
Yes, so the young patients with stroke and the young, so like Leroy, 41 years old, that's very young. There are some unique risk factors that you have to take into consideration. Obviously, when you think of stroke, you think elderly patients or older than 41. And that, those can be related to the diabetes, the hypertension, etc. However, the younger you are, we do have to consider other things. So sometimes we're born with a hypercoagulable issue, whether or not our blood clots differently, whether or not our heart is normal, in terms of whether we have a PFO, which is a shunt, which is a communication between the right and the left side of the heart, whether or not we have a connective tissue disorder. Because sometimes we're predisposed to having issues with the neck, like dissections, whether it be from blood pressure issues, trauma, or things like this. So, am I seeing stroke in the young? I am, and when I do, I have to consider other things other than your typical smoking, diabetes, hypertension, not exercising. We always have to think of other things going on as well.
And I think just, anytime we have an opportunity to be in front of the medical professionals is good. An opportunity for them to screen, check, and see where we are. My wife actually called me I'm with my wife and I were talking over here. She got a call earlier. And again, we have 3 boys, but one of them, the middle is 14, and they have an opportunity to do some screening at school. And I was like, absolutely. Because to your point, why not, right? Why? You'd rather be safe than sorry. I mean, if there's an opportunity to screen and learn and see, and the check is all good, then all good. But if that's not the case, then we might need to, act immediately. So Dr. Maxwell, what can we do to reduce the risk of having stroke?
So you want to just be able to control what you can control. First thing is to, go to your doctor to get a checkup. You need to be able to check and see how your blood pressure is, because if it is high, it might be that you need to do either lifestyle changes such as exercise, eat healthy with your diet, and just make some changes in terms of that aspect so you can lower your risk. The other aspect is if you do have high blood pressure and diabetes and you're taking medications for it, it's just to continue to take them and be aware and also check for yourself, your blood pressure level, your blood glucose level at home, because that definitely can help us as physicians to get better control of those conditions for you, and you'll be able to live a longer life that way. If there's other risk factors, and it's like cholesterol is the same, usually we'll monitor those with blood tests and check your levels periodically, just to make sure that you're controlled that way and just lower your risk of getting a stroke from that aspect.
And another question, Dr. Maxwell, what are long-term consequences of a stroke?
So some long-term consequences are that when you have a stroke, you basically lose function. So you might have trouble doing what you used to do before. Things that were easy to you are known. exponentially harder, depending on how bad the stroke is. So the consequences is that, you have to try to be able to gain back that function, to be able to live your life to the fullest that you can. And, anytime that you are not able to do something, you might require help from someone else. So that's something else that you would have to take into, you know, to be aware of, that you might have to have family members to help you to do certain things. And, no one wants to feel like they're a burden to anyone. So it's best to be able to take care of yourself so that you can prevent these things from happening.
And Dr. Maxwell, what about recovery, right? What is the recovery from stroke?
So the recovery can depend on, I guess, how bad the stroke is. Leroy here is very fortunate that when you look at him, you wouldn't think that he had a stroke at all. I'm just listening to him speak and everything like that. And unfortunately, there are some that are just not as lucky as him. And it's very unfortunate sometimes because there are people that, have been independent all their lives, and then all of a sudden, in just a snap, they become dependent on someone to do everything for them. And that can be disheartening and sort of affect their mental health as well. So recovery, it just depends on how bad the stroke is. Sometimes but there is a recovery process. You have to, because the goal is to make sure to let you be as functional as possible to be able to perform your daily activities and have a life as well.
So again, just, taking a snapshot of this scenario, right, going back, right? And I'm not trying to take this down a negative path. Again, we are so thankful for the blessing that, timing worked out, like stars were aligned, Alondre was in the right place at the right time and things of that nature. But again, and all that you speak about are related to timing, right? Time is brain. You even referenced earlier, Dr. Ferris, about, sometimes people don't even know they're having a stroke, right? Which you always say, he didn't know he was having a stroke. I mean, all those things can be so critical. I mean, this could have been a very different scenario related to time. If he is able to, if Dre is not there, and if he's trying to get out of the car or falls, and it's not able to get his phone, all that time is creating a very different situation than having Leroy sit here in his right mind and, extremities and be with us, today. So thankful for all of that. But also people need to realize that the scenario could be very different. They could be alone. They could, be sitting at home on the couch and not realize what's going on, but having this awareness and education. And we having more awareness and education to make sure that people are aware of what's going on is critical. Or people around us being confident enough to act on something that they're experiencing from them to be fast. Leroy, let's talk a little bit about where you are now, which Tori and I got a chance to talk to you about. Are you experiencing any after effects, any long-term effects from your stroke? I know this, obviously this whole experience has, changed your perspective on health. So I want to know about any long-term effects or any, effects right now, and any lifestyle changes that you plan to make, which we have talked about.
I feel like I have aphasia. And I want to thank my girl Jordan. She's my speech therapist, and she's been, drilling me and heavy, and as far as my whole life change, eating fruit, vegetables, drinking water, and going to the doctor. That's it. That's
What you say, Alondre? I didn't.
and going to the doctor, check up on us. Because men, we need to go, go to the doctor and check up on ourselves more.
And that even having the village around us hold us accountable, right? We often say in Black Men's Health, this is not an arm around the shoulder, but a poke in the chest, right? I mean, we have accountability, right? We have families to raise, communities to build, right? We have work to do, and we need to be here. And so holding each other accountable to make sure that we're doing what we need to do, is important, right? This is not a game. And when we were talking, like sometimes I'm talking out loud to somebody, but I'm also talking to you. Talking to me. Right? I got some shoes that's sitting by the door that I was supposed to get in today that didn't happen, so I gotta figure that out between tonight and the morning. Right? That's accountability to me, right? But I'm saying it out loud, so now I gotta do it because I got people in the room I know that's gonna hold me accountable. Dr. Ferris, let's talk about treatment options. So how did the stroke team at TMH treat Leroy that day?
So Leroy, the important thing about stroke, and we emphasized that time is brain, is not only just the fact that we're trying to save as much brain as possible by coming to the hospital quickly, but because some of the therapy we give is time sensitive also. So you received both TPA and mechanical thrombectomy. TPA is a drug that we give for patients who present last time seen normal 4.5 hours before. And this means that we can try and help break down the clot as much as possible with this drug. Now, what the evidence has showed us is that patients that receive this drug always do better, or for the majority of the time do better in 3 months than patients that did not receive this drug. So in your case, you did receive this drug because you came at a very good time, thanks to your son who recognized that you had a stroke. Now, in addition to that, because of this clot that you had in the vessel in the brain, and we mentioned the left middle cerebral artery, we not only gave you the drug to break down the clot, but we manually extracted the clot. And this was fantastic for your recovery because look at you now, you're doing fantastic. So all of this was done in such a quick time period from, I think, from when you came to the moment you had the mechanical thrombectomy. It was only about 1 hour. And that did a huge favor for you, so I think this also commends your son for recognizing the stroke, but also what we can offer at TMH is we are very conscious of that time is brain, and that we try to have these therapies done in a very quick, efficient manner to preserve as much brain function as possible.
So Tori is gonna get on me for doing my best to say these words. So you mentioned earlier that Leroy had an ischemic stroke. Not that he had a stroke, but educating each other here. So we learned that there is a second kind of stroke that you referenced. I'm not even going to attempt this, but I'm going to give it back to Dr. Ferris, and she's going to tell us what it is and tell us more about that.
Right, so the ischemic stroke, which is the lack of blood flow into the brain like what you had, is about 85% of strokes. And then the other 15% is an example of hemorrhagic stroke. So hemorrhagic is essentially, if you think of what hemorrhage, so blood. So like a blood, basically like a blood pocket in the brain, whether it can be from what we call intraparenchymal hemorrhage, where basically blood is expanding inside of the brain and causing symptoms very much like a stroke. But also there is something called a subarachnoid hemorrhage that can be caused either from trauma or more commonly from an aneurysm, which can come from an outpouching of the vessels in the brain. And should that rupture, that can cause a very bad headache, and sometimes it's referenced as the worst headache of your life, or a thunderclap headache. And also these things cannot be ignored as well, because this is also an emergency. So any horrendous headache that one should have that is out of character, one should always come to the hospital as quickly as possible.
Thank you. Thank you, Dr. Ferris. So where should, this is an easy one for TMH. So where should patients go if they're having stroke?
Yes, I think you got it right. So TMH is an example of a comprehensive stroke center. And so that's a little bit different to something like a primary stroke center. So a primary stroke center are excellent at recognizing strokes and knowing that we should give TPA, which is essentially the drug we give in the vein. However, for us to be able to have the option to mechanically extract a clot from the brain, one should always come to a comprehensive stroke center, which is like TMH. And so I would say, not being biased or anything, but coming to a facility like ours, we're able to help patients like yourself, Leroy, who had a clot in the brain that we can take out in a time sensitive manner. But also, you know, having referenced the hemorrhagic strokes, we also care for these patients too. If we have a subarachnoid hemorrhage and a ruptured aneurysm, we know how to fix those too. So comprehensive is comprehensive in the sense that we can do everything for every kind of stroke.
And I assume, I don't know how all of this works, but detail wise, I mean, again, we can't control when the stroke happens. So no matter what time somebody is coming into the hospital in this emergency situation, there's somebody on staff that has the ability to care for that 24/7. So Leroy, talk to us about your treatment experience at TMH.
Oh, my ICU treatment was good. One thing I remember, I had to get a lot of shots. But you know, it was good. It was good. Everybody was good, and you know, it was just good. You know, good hospitality. I just remember all the faces, all the people that, you know, came out, you know, and took care of me, you know, so I just want to thank you guys.
When we talked previously, you referenced that you said all the faces and all the people, and I was like, all the people like your family, or all the people like, you know, nurses, staff, etc. He said both, like all the people that both scenarios. And we're thankful also for the team at TMH to be doing what you're doing and caring for him. So we're grateful for that. So Tori, if you could let us know any questions in the Q&A or any questions that anybody might have here. Don't make me start poking. Yes, ma'am. Auntie LaShawn.
So I actually get a chance to work with Leroy and Alondre, who is I call him my nephew, quite a bit in the community. But I want to know, like, from Leroy, you know, if he's slowing down a little bit and easing back into it, because I heard, you know, he was gonna be doing his camp real soon. So I just want to know, what does the wellness plan look like? You know, I'm just asking.
And I will repeat, basically, LaShawn was asking, what's the wellness plan look like? Where do we go from here? Are you slowing down? Is Leroy slowing down?
Does he have to slow down?
Does he have to slow? We're gonna pull Dr. Ferris and Dr. Maxwell back in also after he answers.
Yes, I'm slowing down, but I'm you know, Dre is gonna take over that. He's gonna take over there. I'm gonna come, you know, and you know, check on him, watch over him while he's taking over the camp. But I'm still be out there sometimes.
I tell you, before we hand it off to the doctors, I tell you, you know, sometimes when it's our baby, right, we believe we have to do it all. We have to touch it, we have to care for it, we have to cultivate it. And sometimes scenarios like this allow other people to step up and us realize that, hey, somebody else can do it also. We just have to understand that that's reality, and we can give ourselves some space to rest and relax.
Correct.
Dr. Ferris, Dr. Maxwell, have anything for Leroy as he speaks to what he believes he's about to do? Don't hold back, Dr. Maxwell. Talking to all of us.
I don't have anything specific for Leroy, but you know, it's always something between the patient and their physician to discuss as well, just to make sure they're not moving too fast. There are other members of the team that would be involved in a patient's care after a stroke as well. So, you know, their opinion would be vital as well. Leroy had mentioned like a speech therapist. You know, there's physical therapy. There might be someone specifically neuro physical therapy to occupational therapy to try to get you back in working. So there's all members of the team, depending on the risk factor, like sleep apnea, you might need to follow up with a pulmonologist. If it's irregular heartbeat, you would have to follow up with a cardiologist maybe. So, and Dr. Ferris had mentioned a hole in the heart could be a risk factor as well. So you might follow up with a cardiologist or interventional cardiologist as well for that. So there's many members of the team that you would have to kind of follow up with, and it's kind of, you know, you go as you see these people, you know, you make mention of what's going on, and it's usually a shared decision between the patient and the physician.
So I think part of the process of being in the hospital is, of course, taking care of you, making sure you get better, but preventing the stroke from happening again. We want to know why it happened. We want to stop it from happening again. So investigation into why this happened in the first place is also a very important part of it. So we took a lot of blood from you originally, right? We wanted to understand why it was happening, why you were having this clot. We looked at your heart very closely. And, you know, in terms of wellness, if you're slowing down and so forth, what I really reiterate is that we have to control our risk factors, making sure we take our medications, like what was emphasized, making sure we see our doctors. If we are told to take medications, if we're told to control our blood pressure, we have to do that, because it's these little things that can cause you from being, you know, risk-free from stroke. So much like Dr. Maxwell was saying, this is definitely a conversation you have with your physician, and trying to come to an agreement with that.
And controlling our risk factors, that's a whole nother discussion. I mean, that's, you know, so critical for us. You heard me say earlier related to Black men's health about creating balance, right? I used to have this thing I said, if the doctor ever told me to stop eating chicken or cheese, like, just take me out of here. I don't eat them. Well, I have 3 boys, and I can't have that, you know, mindset, right? I have to pay attention. I have to be there, be present. I'm in front of a professional. They can tell me what the reality is. I have to listen and follow orders, right? I mean, we all have our gifts. We all have our expertise and our experience, and there's certain things that I don't have expertise in. And one of them, obviously, I do not have on a white coat. I do not have a clip. So we need to be listening to people in front of us that are educated and have the experience and have done the research. And, you know, again, from Leroy's experience, there's somebody else in the future that could be helped. Somebody that was a predecessor to Leroy, somebody helped that scenario, learning from their experience, could potentially have assisted Leroy's situation and scenario. So us limiting those risk factors are important and critical. I would like to ask Alondre, any additional you would like to add in this discussion?
Just be aware. The time was important. That was pointed out to me. But just be aware of your surroundings. That's all I really would like to add.
And having, again, you having presence of mind to be able to act so fast, right? You having that educational awareness wherever it came from, whether it was those commercials, whether it was that training and experiences you had previously, all of that, you know, critically came to you know, ahead in that moment, which is so important. So we have to do a better job for ourselves. Even the information that you were sharing, Dr. Ferris, just us being aware of our surroundings, what's in our communities, wherever we are, understanding, you know, how our own body is ticking, understanding what medication we're on, being able to recall that. All of that is so critical to us continuing to be healthy and staying healthy for ourselves and our family. Before I close out, Leroy, anything that you like to say in closing?
I just want to thank, thank you guys again, thank TMH, thank everybody, thank my family for, having me, I just want to, I'm thankful, and, and my son, very thankful, I'm thankful for him, I'm just thankful. And that's it, that's the word, I'm just thankful.
So we have grandma here, right?
Yeah, my grandmother, my aunties, and my uncle,
All the pretty ladies and
my ladies, girls here. Yeah.
mom is not here, but
Yeah.
is checking in.
She's here.
Oh, hey, mom. Hey, mom. He told me she not far to reach. He told me. He told me she checking in multiple times a day.
Absolutely.
So we have to be accountable for ourselves and each other, and mom is on
And
the
grandma.
phone.
Yeah.
And grandma, yes, ma'am. And grandma. So anything that we missed that we need to touch on? Tori, go ahead, please.
Parents, if you touch a little bit on TIA strokes, because I know those, I don't know how much more common they are, but if you could talk about maybe how those
Sure.
a little bit.
Sure, so TIA, so it can be noted as a stroke warning or a mini stroke. So these are signs of an impending stroke. So basically, stroke-like symptoms like what Leroy had, but only lasting a short amount of time. And when we do the scans, we don't have any evidence of stroke. So what TIA stands for is transient ischemic attack. Ischemic is different to infarction. So ischemic is a reduction of blood flow into the brain. Doesn't mean necessarily that the brain dies, but it's going to die essentially. It's a way of your body saying, oh, be careful, I'm on the cusp of having a stroke, you have to be careful. And so when patients come with transient symptoms like this, it tells us to still be very careful and to make sure that we do our due diligence, make sure that we can rule out any causes of stroke that one might have. And look at those risk factors and make sure that the patient's blood pressure is controlled, that their diabetes is controlled, they're taking the correct medication for cholesterol, these things. So it's almost as if it is a stroke, but it's your body saying, well, if you haven't had one now, you're going to have one very soon. And so they say that patients who have TIAs are about to have a stroke if nothing changes.
Good, thank you. Tori, anything else? Oh, question, yes, ma'am.
Leroy, I'm gonna put you on the spot. Have you
Okay.
seen a pulmonologist for your sleep medicine, for your sleep apnea?
Say it again.
Have you seen a pulmonologist for your sleep apnea?
I did.
I'm gonna repeat the question. She's asking, have you seen a specialist for your sleep apnea?
I did back in 2013, and then, I gained a little weight, and started snoring back again. I got it. That's the top of my list.
Put it on the phone, Dre. Put it on the list.
I got a question too as well. 2 years ago, I think I had Bell palsy. Was that any, potential, risk of having a stroke now?
So a Bell's palsy is essentially an inflammation of cranial nerve 7. So we have 12 cranial nerves. And Bell's palsy does not necessarily have any association with stroke. However, it really depends why you have the Bell's palsy. But if I can be honest with you, usually it does happen randomly. Sometimes it can be provoked by a virus or something else. But in terms of having a large vessel occlusion, one can consider it to be a risk factor, but it might not be. It might not be, but I mean, it's a very good thought. Sometimes, you talked about young patients and why one could have a stroke in the young. One of the things you do have to consider is things like vasculitis, where you can have inflammation of the vessels in the brain, and that can be related to viruses, infections, some of which can cause Bell's palsy. So again, these are always things that we need to consider. It's not straightforward sometimes when the young patients have stroke. You have to think of many things.
Right.
But no, that's a very good point, and that's something that we shouldn't ignore.
Maxwell?
She pretty much explained it. No, I didn't do that.
He's pretty good at it.
Yes.
What day?
Yes, please.
So, June sixth, we will be having a camp, summer camp. Youth football training camp. Ages from 7 to 14. We're gonna be pop one field, training kids, youth on different skills, speed, agility, position training. Just want to get that out.
June sixth.
June
So
6th.
out at Appalachian Regional Park.
Yes, sir.
What time?
Will be from 6 to 8. 6 to 8. Yeah, PM.
Got
Out there, one get off work. Just come out
Okay.
and registration. We got different flyers and stuff. Like, get it out.
Alondre, you didn't talk about your ball. You got the skills too. Don't let us.
I
Don't
graduated.
go sleeping.
I graduated. I got my bachelor's in finance. I also played ball. It helped me keep costs of my education down.
Less stress for that.
I'm going to get my MBA at FAMU.
That's why we got business to talk about. MBA, so we do some more business. So that brings us to the end of our time tonight. We want to thank everybody on the panel. Thank Mrs. Taylor. Also, thank the panel for sharing your time and stories and especially your expertise to Dr. Ferris and Dr. Maxwell. We want to thank everybody who joined us today and out there in Zoom land. And we'll be sending out an email to everyone who registered with the recording of tonight's talk. And if you'd like to learn more about stroke and advanced interventions available at TMH, please visit tmh.org/stroke. All right, thank you all. Have a wonderful rest of your evening. And we'll do it again soon. Thank you.